Welcome to Shri Medical College. Today we will explore physiotherapy for back pain, relief and rehabilitation strategies. Most people classify their low back pain as either acute, subacute, or chronic. This category takes into account how severe the back pain is. Lower back pain is classified as acute if it lasts less than 6 weeks, subacute if it lasts between 6 and 12 weeks, and chronic if it lasts longer than 12 weeks. Physical therapy is an option if other non-invasive treatments for lower back pain have failed. Massage, manual therapy, and acupuncture are examples of alternative treatments that can complement conventional physical therapy well. There are cases where a combination of physical therapy and lumbar epidural steroid injections from a specialist is the most effective treatment for chronic back pain. If necessary, doctors may also prescribe pain medication. Physical therapists frequently offer self-treatments, such as heat and cold therapy, to alleviate pain and inflammation and hasten the recovery of injured tissues. Intense pain in the back that lasts longer than 3 months is considered chronic. More than 80% of all healthcare costs can be attributed to chronic low back pain. Some 31% of those who contact a doctor about low back pain will still be in some degree of discomfort a year after their original visit. Chronic low back pain affects almost 7 million people in the United States. The main goal of a physical therapy evaluation for back pain is to triage the patient based on diagnostic criteria from internationally accepted back pain standards. Fracture, malignancy, infection, and ankylosing spondylitis are rare but important causes of back discomfort with neurological impairments, such as radiculopathy, Cauda-Equina syndrome. 5 to 10% of individuals with low back pain have specific symptoms like weakness in their legs or arms, but only 1 to 2% of those people have a serious underlying cause. When more significant and specific causes of low back pain have been ruled out, a diagnosis of nonspecific, sometimes called simple or mechanical, back pain is made. Pain in the back that cannot be traced to a specific cause is called axial, or generic, back pain. Being overweight and/or adopting a slouched posture often are two of the most common contributing factors to this problem. Physical therapists stretch and strengthen persistent axial back pain, spinal pain, patients. They reduce risk factors. A disorder that may irritate or compress a spinal nerve in the lower back, causing discomfort in the lower back and or legs, but not necessarily called sciatica. Sciatica physical therapy includes extension and flexion, forward and backward bending exercises, lumbar strengthening exercises, nerve and joint mobilization therapies, and others. Physical therapy and exercise following spinal surgery can help with fatigue, getting back to normal activities faster, and preventing setbacks. Regular involvement in a guided exercise program is sometimes recommended to hasten recovery from surgery and reduce the probability of recurrence back problems. Patients who have just undergone surgery should begin an exercise regimen that includes cardiovascular activity and a focus on strengthening the abdominal muscles, the back, and the legs. Over 90% of patients visiting primary care have a diagnosis of nonspecific low back pain, which is the most common reason people seek physiotherapy for low back pain. An evaluation for physical therapy looks for restrictions that could be the source of the pain or that increase the likelihood that the pain will become chronic. It's true that biological causes can induce weakness, stiffness, sadness, fear of movement, and catastrophizing, but psychological and social variables, such work environment, also play a role. Evaluation does not focus on isolating individual anatomical pieces, such the intervertebral disc, as potential sources of pain, in contrast to peripheral joints like the knee. International standards and past research suggest that it is not necessary to determine the particular tissue source of pain in order to effectively manage mechanical back pain. Therefore, diagnostic imaging is not recommended, especially in the first month. Diagnostic management should be undertaken when low back pain does not improve with routine treatment and a change in approach is indicated, or when a more serious condition is suspected. The pelvic and hip muscles create the base, the diaphragm and the top of the lungs constitute the middle, and the abdominal muscles form the front of the core. The inability to properly distribute body weight between the vertebrae of the spine and the muscles of the legs can lead to discomfort in the back or a worsening of pre-existing back pain. Regular practice of core strengthening activities reduces lower back stiffness and improves mobility. Pelvic tilt, cat-cow posture, bird dog, high and low planks, crunches, and Swiss ball movements can relieve back pain, or exercise ball. A strong back needs an equally strong pelvis and thighs so that you can walk, bend, and twist without any trouble. Weak hip and leg muscles are a known contributor to spinal instability and pain. Stretching exercises can engage and strengthen muscles like the iliopsoas and hamstrings, improving hip-spine coordination and force distribution over the lower back, pelvis, and legs. Hip and leg movements such as hamstring stretches, squats, downward dog, planks with leg lifts, and lunges are all good options for beginners with lower back pain. Since the lumbar spine's neurological and musculoskeletal components can be impacted by diseases like arthritis and spondylosis, low back pain is commonly accompanied with leg discomfort. There are many potential explanations of the patient's radiating leg pain, thus it is important to rule them out before arriving at a diagnosis. The plank, diagonal arm and leg raise, trunk rotators, posterior buttocks, leg muscles, and oblique abdominals are strengthened with basic workouts and stretches. Among the 8 primary categories of physical exertion, throughout the 8 weeks, the patient should record their exercise intensity after each session to monitor their improvement. Aerobic exercise heals back muscles and maintains heart healthy. Cardiovascular exercise promotes heart rate, blood flow, cellular oxygenation, and energy production. These methods calm painful spinal muscles. Walking, biking, or using an elliptical trainer helps relieve back pain. Swimming, diving, and other forms of water-based training are a fantastic way to get in shape without placing excessive pressure on your joints. Water's buoyancy reduces spine pressure and increases movement. Maintaining muscle and bone balance with good posture decreases bodily strain. Constant slouching might be caused by poor ergonomics at work or at home, chronic discomfort, or simply bad habits. Pain and trouble with daily activities can come from incorrect posture, especially in the spine, because it limits the range of motion of the tendons and muscles. By stretching and strengthening the back, abdomen, and kinetic chain muscles, posture correction exercises increase spinal stability. Calf stretches, seated squats, pelvic tilts, and abdominal strengthening correct posture. Physical therapy comprises education, exercise, strength, flexibility, and endurance. The knowledge and experience of a physical therapist are crucial when designing a treatment plan that is tailored to the specific needs and limitations of each patient. Physical therapists show their patients how to exercise in a healthy, productive way so that they may take care of themselves. Join Shri Ram Medical College's Bachelor of Vocation in Physiotherapy and take the first step toward a successful career in physiotherapy. We are here to assist you in launching your career as a physiotherapist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Ram Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.